somehow it got the name Concierge. And so people assumed that it was expensive, when in fact there are studies that are now demonstrating that patients who engage in a personal fiduciary relationship that is in keeping with the business relationship, those patients pay less for health care because they're less exposed. Our patients don't go to the emergency rooms. Our patients, we actually know what medications they're on. We don't do redundant testing. They see fewer specialists. All of those things. And I think it's more than just the cost of health care being kept down. They're kept in their lives. Our patients are still working because they can. They don't have to take time off to go to the doctor. They get their knee fixed in a minute. You know, when you talk about data and big data and worldwide data and where healthcare is really being done well, unfortunately the data that we hear about, for instance, the World Health Organization, doesn't really track the things that I think are important. So, indeed, if a patient waits a year to have their hip replaced, it can be a very good hip replacement. And if you're measuring the result of the hip replacement, it'll be a good hip replacement. And a country like Sweden and a country like the United States will rank reasonably the same. However, the person in Sweden waited 2 years for that hip replacement. They've been out of work, they've been in pain. Our patients, your and my patients, specifically more even than other patients here in the United States, come in, they have a problem, they see the orthopedist that day, they're on the surgical schedule the next day, and they're back to
valuable.
work, and that's very valuable.
I remember reading about a